Hi, Grandma. Today we're going to talk about diabetes, which is affecting around 9% of our adult population. And in fact, the United States has one of the highest rate of this disease among Western countries. And unfortunately, 1 in 3 of our kids born in 2000 will develop this disease one day in their life. So, what is diabetes? Diabetes is a clinical syndrome characterized by elevated plasma glucose level. There's two major types. Type 1, which is an autoimmune disease related to T-cell destruction of pancreatic beta cells where insulin is produced. So basically, these patients will lack their own insulin, and the vast majority of those cases are seen during childhood. The other type 2, which is seen mostly in during adult life, where insulin production is insufficient and peripheral tissues develop resistance to insulin. Both types share a common pattern of early symptom presentation, which include fatigue and the three P's: polyphagia, which is increased food intake; polyuria, which is increased urine output; and polydipsia, which is increased water intake. How is diabetes confirmed? By an 8-hour fasting blood glucose level of more than of 126 milligram per deciliters or over on two occasions, or any random sample yielding a level of 200 milligrams per deciliters. Keep in mind the normal fasting blood glucose level should be less than 100 milligram per deciliters, and levels of 100 to 125 milligram per deciliters are considered pre-diabetic, and they are indicating that there is some impaired glucose tolerance. Risk factors to develop diabetes are numerous and may include age of over 45, family history of diabetes, poor activity or exercise as seen with other health problems. Also for ladies, PCO, polycystic ovarian syndrome, which is where ovaries are filled with those non-functional cysts, and gestational diabetes. I want to mention here a very important risk factor, which is not only associated with increased risk of diabetes but also for coronary heart disease and stroke. It is metabolic syndrome, which is defined by having three of the following: fasting blood glucose of 100 to 125 milligram per deciliters, abdominal obesity or excess weight around waist, basically if waist of 40 inches or more for men and 35 inches or more for women. A low level of high density lipoprotein, the HDL, the good cholesterol, like levels less than 40 for men and less than 50 milligram per deciliters for women. High triglyceride levels of over 150 milligram per deciliters for are considered a risk factor. And lastly, the blood pressure of 130 over 85. As you can tell, these characteristics are mostly seen among obese patients. Um, Complications with diabetes is very problematic, and diabetes has been associated with complications affecting most of our organs and systems. I will start with the heart diseases, which is the leading cause of death among diabetic patients. In fact, 70% of those patients with first attack MI or myocardial infarctions have impaired glucose tolerance or undiagnosed diabetes, and 70% of diabetic patients have high blood pressure, and as known, hypertension is a non-risk factor for both coronary artery disease and stroke. Eyes are also affected by diabetes, and diabetic retinopathy has been responsible for 12,000 to 24,000 new cases of blindness each year. cataract, which is clouding of the lenses, and glaucoma, which is increased intraocular pressure. Has been other ways where diabetes can lead to the development of blindness. ESRD, end-stage renal disease, is one of those complications of diabetes. End-stage renal disease can be managed by chronic dialysis or kidney transplant, and diabetes has been the leading cause for ESRD. Lastly, I want to talk about peripheral neuropathy, where patients are complaining of numbness, tingling, paresthesia, and loss of sensation, and this will eventually lead to the development of gangrene and amputation. So, given the magnitude of these complications, diabetic patient must be managed by a complex medical team consisting of internist, nephrologist, dermatologist, neurologist, and dietitians, and to ensure good glycemic control and to slow or delay the progression of such complications. The way to monitor glycemic control is by measuring HbA1c, which is the glycated hemoglobin, and with an aim to keep the level of HbA1c less than 7%. Okay, Grandma, I wish you a healthy Thanksgiving day and enjoy your turkey. Bye.